Come in. Hello.
Hi.
Hi, my name's Bailey.
Hi, Bailey. Nice to meet you. My name is Kaci. I'm the nursing manager here.
Okay.
If you'll have a seat, I've looked at your resume and looks really good here. I see that you're a PCT Granbury.
Yes,
That's
ma'am.
awesome. All right, so the inpatient psych unit. Is this an area that you're interested in?
I very much am. My mother and stepfather work in this field. They're both, my stepfather's a psychiatrist and my mom is a counselor.
Oh, wow.
So psychology has always been like a topic of discussion in my household, and I'm very
Apple
interested
doesn't
in
fall
it.
far from the tree.
Right.
Well, I'm really glad to meet you. I would just want to dive right into it, because I really like what I see on your resume. So I'm just going to ask you a few questions. Take as much time as you need to answer them. There's no rush. Take a deep breath. It's going to be fine. But we'll just get right into it. So, well, let me give you a little bit about this is an inpatient psychiatric unit. So you're going to come across a lot of different types of people, a lot of fun characters.
Colorful
Very
environment.
colorful, very interesting, very challenging sometimes. So I just want you to keep that in the back of your mind whenever you're answering these questions.
Okay.
Okay, so how have you handled a challenge in your past? Just give me an example of.
Okay. Well, I'm faced with a lot of challenges daily. The main challenges are dealing with time management, just because I am a student in nursing school. I also work nights as a tech, and then I've got a puppy and a cat at home that has to take a lot of my time. They're like my children. But a main challenge recently at work that I've had to deal with is kind of finding that confidence and courage with difficult patients, how to communicate in a way to where I'm not coming off stern, but I'm also letting them know what options they have, because there are some patients that are disruptive or agitated or confused at nighttime, especially where they want to become aggressive and go do what they want to do, go storm the halls and stuff, and they really can't do that, and I have to dive within myself to conserve my own feelings of either frustration or sometimes anxiety and fear if they are a little
Yes, ma'am.
aggressive, and then be able to know, communicate with them in a way to where it comes across that I'm here for you, I want to take care of you, but these are your options, this is how you can act right now. Which do you want to do? Do you want to go lay back down in bed? Do you want to walk for a little bit? But you can't just go storm around and act the way you want to act.
Right. So you're no stranger to interesting
Yes.
characters. So at nighttime, that's very true. That's great. Okay. Have you ever experienced a time when you had to work on multiple projects at once, and how did you prioritize?
Yes. So I like to be involved with where I work, just because in case I do stay there for a long time or ever come back, I want to be known and people be familiar with me as oh, Bailey used to work here, and not just the night tech who disappeared one day. So I'm involved with the Blue Crew at Granbury. It's just a little group that we help with community stuff, we helped with the homecoming float for Granbury and get that ready. Whereas I also have projects and assignments for school all the time, having to study for tests, and then at work, projects in the daily night shift of
Absolutely.
getting the tasks that I need to get done. There's always lots of little projects within life, putting in together, and it just involves making a to-do list, staying organized, prioritizing what needs to be done now versus there may be something big, like for instance achieving an RN degree, something big I'm trying to achieve, but little things that I have to do now to be able to get to that point.
Right. You have a lot of important things going on right now. That's great. You're busy. Okay, so tell me about a time you needed to get information from someone who wasn't very responsive.
So, well, first, how I think is, are they not responsive due to medication, due to a behavior, due to an illness? They could just be hard of hearing. So clarify, really enunciate, repeat what I'm saying, maybe try to gain their focus if they're lethargic, if they just came out of surgery, still have that anesthesia wearing off, or if they did not sleep very well during the day. So maybe just get their attention, nudge them, make sure that they are awake and giving me their attention. Because, you know, I never want to get an answer and it's because they were half asleep and it's not really the answer that they were wanting to give me.
Sure.
Or if they're not responsive due to an almost emergency, if their O2 stats are dropping and they're not responsive because they need medical attention, then that's also why I kind of assess, why are they not being responsive? I need to figure out and make sure that they're okay.
Right. That's great. I want to take that in a little bit of a different direction. Is there anything that in school, with fellow students or in your clinicals, where you had to work with your peers, not necessarily your job right now, but where that situation might have happened where they're not very responsive to you, and how did you handle that?
So here with the student not being responsive, kind of like not wanting to talk with me or work with me in a sense?
Maybe. Let me make a note right here and we'll come back to that one. Okay, sorry about that. Can you tell, this kind of goes into the next question, so maybe it'll, maybe I just jumped ahead of myself, I apologize. Tell me about a time when you had a difficult group to lead, and then how did you manage it?
Difficult group to lead. So being a student nurse in nursing school, we're constantly doing simulations where multiple of us students are together, and sometimes someone has to take the leader role. Or even in clinicals, I'm a senior, sometimes I'm put with juniors who are less experienced and are afraid of the world, and I kind of have to lead them and let them know that it's going to be okay. A difficult time would be, in the simulation experience, people of my own age that are my peers and we're all at the same place. Sometimes I try to take the leadership role just to help us get and achieve the goal we're trying to achieve for that simulation, and sometimes other people feel threatened or challenged by that if they also were wanting to be the leader, and you can sometimes butt heads. So a challenge should just be keeping that open communication and keeping that respect for each other.
That's what I wanted to hear.
Yeah.
So very good. All right, next one. I did kind of match those two questions together, but great answer. All right, describe a time when you struggled to build a relationship with someone important, and how did you eventually overcome that?
Okay. So at an old job I used to have as a teenager in high school, I was a waitress at a pizza place for about 4 years, and I did not have a good relationship with my boss. They were a great boss, very good at delegating and letting me know what expectations of the role. It was just a personality conflict. We just didn't mesh well personality-wise. And so in order to overcome that, I just tried to be the best employee I could be for them, to give them the respect they deserved as my boss, to also try to maintain that I was doing my job in such a good way that they respected me as their employee and didn't feel like I was less than them in a sense. I gained their respect over time, to where, little by little we would start chatting during breaks, and, a relationship grew from that of doing good at our work.
Did it take a long time for that to
Yeah,
happen?
it did. It took about probably 3 months before we got to a good,
That's actually really,
a good place. In the beginning, it was just, I just worked, and that's all I did was just work, and we didn't really speak. But as they saw that I was really trying and doing good, then they kind of opened their mind to me more. And let me talk
great.
with them.
So whenever you left that job, was that person still your boss?
Yes, they were, and we ended up being pretty good friends. Her name was Greta.
Wonderful.
And and she, got me a present for nursing school and stuff. So.
Oh, that's so nice. Okay, great. Okay, describe a time when you had to interact with a difficult client. What was the situation and how did you handle it?
So I did kind of briefly note on that earlier.
Yeah.
We did have a client. He was aggressive, kind of a little confused and delirious, had sundowners. And with him, it was just, I kind of had to take that role. Sometimes patients, they think nurses were almost like servants, which we are servants. We're also doing our job, and we have to choose within ourselves what is best for the patient. Can't just let the patient do everything they want, because with a lot of their decisions in life, it's gotten them to where they're at in the hospital. And so we've got to make that decision of what is best for my patient and give them options in a respectful way, that this is what you can do. And so that's how I handled that with him. He was very confused, and so I kind of had to talk in a way to where I wasn't challenging him or making it worse, and that he still felt heard, and not like I was just bossing him to get back in bed, or not making him feel rejected in a sense. A lot of people, even though they are delirious or confused, they're still there and they're still people.
Sure.
So you have to just communicate in a sense to get them to do what is best for them and that they want to do it with you.
So in this particular instance, during that shift, were you able to complete that shift interacting with that patient?
Yes, I was able to do so, but there were a couple of moments where, I also got to know my limits, and there were times where I was a little fearful that the aggression was rising and I couldn't diffuse the situation, so I did. I just pressed the call. I had my charge nurse come in there with me, and we both helped diffuse the situation, but I was able to complete it and stay with that patient the whole night.
Awesome.
Yeah.
Great. All right, and this is the last question. Have you ever had to convince a team to work on a project that they weren't thrilled about, and how did you do it?
Team with a project.
And this could be in, fellow students, or it doesn't have to be at your job.
Actually, I do have, with school, a couple weeks ago, we had an assignment where we had to come together as a group and basically make a presentation for our class, for our fellow students, kind of like as a little study guide for our informatics class. We had to come together, pick a couple chapters, write a little report about those chapters, and then figure out a way to present it to the class to where it's fun for them, they're learning, and everyone was happy. Well, the ideas that I had for what we could do, they did not like. They wanted to stick with, let's just do a little quiz, and I wanted to play Jeopardy and make it fun, have prizes and stuff. And honestly, the only way I could get them on my side was listing out the pros and cons. Well, if we do this, this is like what good comes from it for everybody, and how much easier it is for us to do it this way. Versus maybe some of the things they were wanting to do. Well, that's fine if you want to do that, but you have to think we're going to have to do all of these things as well. And then we were able to put our heads together and combine it to where we did still play a game with prizes. We didn't do Jeopardy, but we did do a quiz-like game.
So you were the only one that wanted to do Jeopardy?
Yes.
That everyone was against you?
Yeah.
Oh no.
So just compromise, and I ended up having to compromise myself, and we all agreed on a quiz game. But, in order for them to at least know that I was heard and respect my idea, listing the pros and cons, explaining what good will come from it, what advantages they will each get from picking what we wanted to do.
Right, I like that you did the pros and cons. That's
we
an
do this
old
now,
school way to
then later.
approach problems, and
Right.
it still works. It's timeless. So, well, that's all I have for today. You've given me everything that I've asked for. It's been a pleasure meeting you. I appreciate you coming in and talking with me. We should get back to you within the next few days. I believe no later than next Monday.
Okay.
So I've got this. I'm gonna send it over to my director, and we'll be in touch.
Awesome. Thank you so
Thank you so much, Bailey.
Have a great day.
You too.